Hello, everyone. Welcome to the Maternal Newborn Nursing Certification um, Exam Prep. My name is Natalia Venichuk, and I'm going to be your instructor for this course. I have 14 years of nursing experience, and I have a bachelor's degree in nursing, currently working on my master's degree. The first 7 years of my career, I've worked in multiple med-surg, oncology, telemetry units, and my passion's always been in women's and infant services. So for the last 7 years, I've been happily working on a postpartum unit. We also take care of GYN population. I've served in charge nurse, clinical nurse coordinator roles for most of the time on this unit in some form. I took my certification exam about 3 years ago. It was a really hard exam, I'm not gonna lie. I've learned a lot through the process, through the review and studying for the exam. I've learned some new information. I've also remembered a lot of information that I think I've forgotten since nursing school. I think I've gained pride for myself in the expertise and professional level of knowledge that I do have. I did pass my exam on the first try, which I was happy because during the course of an exam, it was really hard to gauge as far as if I was answering the questions correctly or not. It's just a really hard and tricky exam. So why do we need certification? There's multiple reasons. One of them is employers seek out nurses with certification. You kind of have an upper hand when you're seeking employment. For your patients, and it's an attestation to you of your professional knowledge and expertise as well. I think for nurses, it's also a level of pride that you have in your own professional growth and development and the level of knowledge that you have. So this course I've built into a 3-week course. So each week we have one class and we cover different information each week. So for the first week, we're going to cover the maternal side of it. So anatomy, physiology, pathophysiology of certain complications related to childbearing. And then we're going to review some case studies that are true case studies from just life situations. On the second week, we're going to review all the newborn side. So newborn anatomy, physiology, how your circulation and breathing, everything changes with birth and then transitional period. We're going to review pathophysiology of different newborn complications that you may encounter, and then also review some case studies. The third week, we're going to spend solely on just test taking. So we're going to talk about test taking strategies. We're going to talk about this particular certification exam and what you might expect, if you have to reschedule it and what you might encounter during the exam. Also, at the end of it, we're going to take a real full-size practice exam. It's going to be built to your online course as well. At the end, you will know whether or not you have passed the exam, and then you're going to have feedback as far as where you did well or where you need to study more before you take the actual exam for your certification. So I guess good and the bad thing, you have to recertify every 3 years. You don't have to retake the exam, but you do have to take continuous education courses, and it depends on what you get assigned pretty much, and you will kind of learn about this later. I think, to us, thinking that we have to do this every 3 years is kind of a pain. However, how are we motivated to continue learning unless we have to do something? So because we have to recertify and you need to take these continuing education courses, then you end up learning more relevant things about your specialty, learning up-to-date practices and new research developments, which will make you a better nurse and will make you more proud of how well you're doing in your profession. So I hope you guys are proud of yourselves in the place that you are, getting ready to take this exam. Please give me feedback. I welcome all the feedback. So I would love to know where you think this class could be more beneficial and how it can be adjusted or changed. Ask me questions. I'm available. I'm going to provide my email and phone numbers for you so you can contact me anytime. And I hope this class is very valuable to you and that you find yourself ready to take and pass the exam and just be proud of the nurse that you are. Thank you.